welcome to Social Work Week and to this event, bringing people together to learn, connect, and influence change. We're really pleased that you're able to join us today. So, I'm here as your lead for the session, but I'm not one of your presenters. So, I'll start us off with a few housekeeping slides, and then pass us over to our colleagues from the DFE. So, any views, information, or opinions expressed by third parties during Social Work Week are the speaker's own and don't reflect the reviews of Social Work England. Social Work England haven't endorsed the third-party content and are not liable for the content of sector-led sessions. And now over to our presenters for the session.
Oh, my connection just dropped for a moment.
Panic there.
And there was a problem displaying my content. Let me try one more time. And there we go. First technical hiccup. It wouldn't be a broad presentation without one. Morning, everybody. Really nice to be here again. I did a session last year in Social Work Week. Thank you, Katie, for the introduction. Thank you to Social Work England for hosting it. I've managed to go to a few sessions this week. It's felt really positive, which is really nice. My name is James O'Donoghue. I'm Deputy Director for Social Work Workforce at the Department for Education, and I'm joined by my colleague, Jim.
Hi, everyone. Nice to be here. It's my first Social Work Week. I'm Jim Magee. I work with James, and I'm the lead on what we're calling this social work induction program, which had a previous name of the Early Career Framework, for those who were confused at all about what we're talking about.
Thanks, Jim. So I'm going to talk for a bit and then I'm going to hand over to Jim. So you may have seen already this morning that we have launched a consultation into a new set of post-qualifying standards and social work induction. So that's going to be the main meat of the session today, and there's a link in the slides, and I think one's going to be popped into the chat for anyone who hasn't picked up on the latest news. We thought to do so, to talk about the consultation, it would be helpful to set that in a bit of context. So in terms of the overall children's social care reform agenda, and also more specifically about the social work workforce. So I'll do those two bits, and then Jim's going to talk in detail about the consultation and what's in there. Before I launch into that, I wanted to say two overarching things. At various points in the slides and at various points, we will say things like subject to the spending review. So you'll know there's a spending review ongoing, which will set departmental budgets from financial year 26-27 for 3 years. And you'll also know that the fiscal context is quite tight at the moment. So while we have lots of plans, we do need to wait for the outcome of the spending review to enact them. And the second thing to say, as a sort of to say up front, is we're obviously from the Department for Education. We're principally focused on child and family social workers, and that's what we're talking about today. So while we may use the shorthand of social workers, we mean child and family social workers generally. Okay. So, as I say, let me give a bit of context on why we're focusing on early career support for social workers, and hopefully you'll see the links to the overall reform agenda. So, starting at the really high level, you probably know, but worth reiterating, the government is focused on 5 missions that it's talking about. So, they are economic growth, clean energy, safer streets, breaking down the barriers for opportunity, and the NHS. And our Secretary of State, Bridget Phillipson, is the lead cabinet minister for the Opportunity Mission. And that seeks to build opportunity for all against 4 what we call pillars. So best start in life, family security and keeping children safe, helping every child to achieve and thrive, and building skills for opportunity and growth. And I think what I hope to sort of show you in that is that children's social care, is right in the heart of the opportunity mission in terms of the Keeping Children Safe pillar. And we also saw in the manifestos last year 2 really key commitments in the manifesto around children's social care as well. And I think all of that speaks to the emphasis that this government is putting on children's social care, which I'm sure we'll all agree is welcome and really important. And for good reason as well. So we had an election last year, it won't have escaped your attention, and we've had a change of government, but the fundamentals haven't changed around children's social care. So I thought it would just be helpful to throw up a few statistics to emphasise that. And what this is sort of showing is that while the number of children in need has remained relatively stable over the last 10 years, the number of children looked after has increased really quite significantly, so 22% since 2014. And I think the sort of stat at the bottom there that nearly 2 million children needed the support of a social worker before the end of their school years, and that's the equivalent of 5 in every classroom, just really sort of brings home the importance of social work and of social workers, and again is sort of why we're particularly focused on that aspect of the system and that aspect of the reform agenda. And with the growth of the number of children looked after, we've seen a really quite significant growth in the spending on statutory services and a reduction in the growth, a reduction rather in the spend on non-statutory services. So over the last 10 years or so, spend on statutory services has gone up more than £3 billion, while spend on preventative services has gone down by about £1.5 billion. And we've seen a real shift in the emphasis of the system. And, money matters, of course. That level of growth in spending is not sustainable, particularly in the current financial context. But in terms of the reform agenda, what's really, really important is that actually we know that children and family outcomes are far, far better if we're able to focus on the preventative end of the system. And so, yes, there's a cost imperative, but the real imperative is about improving outcomes for children and families. You may have seen as well, since the autumn, the government's taken some pretty quick action on this area, with quite a lot more investment in different things. I'm not going to read through every point on this slide, but I just wanted to highlight a couple. The first was that the new £250 million prevention grant, and that again is about trying to place more emphasis on the prevention end of the system to hopefully prevent children ending up in care. And the one underneath that, which isn't a sort of investment of money, but I think is really important for local authorities. So trying to consolidate grants to reduce the amount of bureaucracy and inefficiency in the way money flows around the system and free up people's time and resources to focus on frontline services and the things that really matter. So that's more of a sort of technical shift, but I think nonetheless important. And then the last thing I was just going to flag, so the spending review is being done in 2 parts. So we had the first part last autumn, which set the 25-26 budgets. And as I say, the second part of the spending review is underway at the moment. But in that first part, the government committed to going further on children's social care reform. And so, as I say, we're working on that at the moment, and further details in due course in the summer when the outcome of the spending review is announced. But I think a really good indication of, again, the level of priority the government's placing on this area of work. So that's some of the kind of short immediate term action, but obviously shifting the whole system around is a long-term game. And we published in November a sort of policy statement setting out a vision for the future, keeping children safe, helping families thrive. And you'll be aware the Child Wellbeing and Schools Bill is going through Parliament at the moment, and much of the policy measures in this document have made their way into the bill. And that is really important because for some things we need those legal powers to affect the change in the system that's so important. Again, not going to read through the slide, but within all of those areas of priority, the thing I would draw out is that it's social workers who are crucial to these things being effective and key to delivering this vision. So as I said before, the fundamentals around children's social care haven't changed, and the things we were talking about a year ago in terms of the various different reports and independent reviews over the last 3 or 4 years are still informing what we do today. And the way we're thinking about the overall reform agenda is in these kind of 4 buckets, if you like. So prevention, as I've mentioned already, that children should remain with their families where possible. Support, so that where children can't remain at home, we're really focusing on things like kinship support, fostering, and support for care leavers as well. A really big issue around the market, so the placement market, that's one of the things that really is driving up the costs and taking action to limit excessive profit making. And then finally, thinking about the key enablers, and this is where my part of the world comes in. So really focused on what are the things that we have to get right to make sure that the other things can be a success. And workforce, and particularly the social work workforce, is really front and centre of that in terms of the enablers. So, talking of the workforce, and again, just a bit of context to kind of set the scene. We do an annual census of the child and family social work workforce, and the latest one was published in February, at the end of February, so just a few weeks ago. And this is a sort of snapshot of different things that are happening in the workforce at a moment in time. So the census is done, I think, late September, and then we were able to publish the results in February. So there's a bit of a lag, but over time we're able to build up quite a clear picture of the trends. And I think our sort of takeaway from this one was one of cautious optimism. So some of the numbers are moving in the right direction, which is really good to see. But we know recruitment and retention of social workers is still a big challenge, and we're really focused on trying to address that. So just briefly, more social workers in post, the highest in the series, which started in 2017. Really encouragingly, the number of agency social workers has come down. And I'll say a bit more about the rules on use of agency social workers in a minute. Vacancies down as well, turnover down, and that's really important for the stability of the workforce, because a stable workforce means stable relationships for children and families with their social work, which we know is really important. Average caseloads down as well. We know that masks significant variation both within local authorities and between local authorities, but as a headline measure, encouraging to see, but not all going in the right direction. So sickness absence rate slightly up. So as I say, some cautious optimism, but we know there's more to do. And there's a link there on the slide, or if you Google that, you're able to dig into those stats a little bit more. So as I say, more to do, and we've already got quite a significant programme of work underway to support the workforce, to support children and families. So lots of activity in the initial education space, bursaries for social work students at HEIs. Those are delivered by the Department of Health and Social Care. We run 2 fast-track routes out of the Department for Education, which you'll be familiar with, Approach Social Work and Step Up. And we're funding 78 local authorities to increase the number of apprenticeships. the assessed and supported year in employment have been running for many years. We're going to come on to talk about our vision for improving early career support for social workers, but that remains at the moment. And then a real focus on leadership as well. So we know that really high quality leadership is not only important for social workers and creating that right culture, but also for the systems that support children and families as well. And then lastly, so support for social workers, we launched what we call a national virtual hub called Support for Social Workers in October, and that includes various bits of information, advice and guidance, and it'll be the number of resources and information will be populated over time there, including from things from the National Workload Action Group. So it's a group of people really thinking hard about how do we reduce the unnecessary workload for social workers and free up time to support children and families. And then, as I say, we published statutory guidance in September on the use of agency social workers. Given that the census was only a couple of weeks after we published the guidance, it might be tempting to say, well, that didn't have an impact, but actually there'd been a long lead up to those. And I think the knowledge that was coming meant we saw different behaviours from people in the system. And so really encouraging, hopefully, to see that they're starting to have a bit of an impact. And as they are now statutory guidance, and there's a measure in the bill that's going through Parliament as well, we start to see that impact increase. And then very, very lastly from me, before Jim talks more in detail about the consultation. So I just wanted to talk about sort of how we're trying to do this stuff. And really, as the slide sort of says, that's in the spirit of working collaboratively with the sector. We know we don't know everything, and we know we're not experts in everything. So we engage a lot through various different groups. Some listed on the slide there. We do things like this and come and talk in a more set piece way. When we're developing policy, we try and get people in who are real experts in this. And Jim mentioned what was the early career framework. We had a group of local authorities working with us on that, who had already done a sort of extended ASYE into 2 years. And so what we wanted to do was learn from what's happening already to develop national policy. And increasingly, we're looking at digital delivery, and that it has in its heart sort of user-centered design and user research. I mentioned the Support for Social Workers service, which is live at the moment, and the link is on the slide there if you wanted to have a look. And lots of co-design gone into that. And as part of the new social work induction programme, which we'll talk about, we're thinking about how a digital service can help the implementation of that. And again, working with users, social workers, to make sure that is as good as it can be. If you want to get involved in any of our user research, you can do. It's sort of how long is a piece of string? It's very often a short interview. We create prototypes, we get people to test things, and see how kind of quote unquote real people react to the things we're developing, and that's real people as opposed to civil servants. And so details on the slide there if you do want to get involved and offer your support, and we'd be most grateful for that. But that's all from me. So I will keep driving the slides, but I will let Jim talk to you more about the consultation that we've launched today.
Great. Thanks so much, James. Everyone hear me okay, I hope. Okay, well, if you're going to keep the slides, that's fine by me. Thank you. Shall we move on then to the next slide and maybe the one after, if that's okay? Okay, just to reiterate James's message at the start of the session there, that the consultation on all the things I'm about to talk about is live, launched at 10 this morning. That link there might be slightly out of date, so I think Laura's going to post a different one in the chat, which is the actual live link, so that will be there for you. And we're also hosting 2 webinars, which the dates are there on the slide. So 2nd of April, 11 to 12 and the 7th of May. We saw they're more broadly the same sessions. We just wanted to have one at the start and one near the end of consultation. Consultation runs until the 28th of May, by the way. And I'm delighted to say that at these two webinars, we will have Laura Eden, who was the chair of the expert writing group, now the DCS of Newham, as people probably know, and hopefully a few more members of the group as well, which would be really good because, you know, as James and I were saying, we're here to work with ministers and deliver the things they want to do, but obviously we rely on experts in social work for this work. So I didn't write the framework, therefore the PQS, it was the writing group. So it'd be great to have them there, and I will sort of lead the session and then they will tell us more about how they went about it and what's been done. Okay, brilliant. Should we move on to the next slide, James? Thanks. So just here's an overview of what I'm going to talk about in the next sort of 15-20 minutes or so. So three sort of things to cover really, I think, which is the new post-qualifying standards. So that's the main focus of the consultation. As James said also at the top of his session, all of this is subject to the spend review. So the consultation focuses mainly on the post-qualifying standards, which quite rightly because we really want people's views on those, but also because the programme that follows the post-qualifying standards that we're currently, as a working title, calling the social work induction programme, is all subject to spend review, which we'll be hearing about in a few months' time. And until that's all settled, we can't talk in detail about anything because we don't, no one in government has the funding for these things yet. And so I'm going to talk a little bit though about what we're proposing in the consultation, because we do have a proposition that we're testing with people, but with the heavy caveat that this all depends on the funding. And then the third area I want to talk about is the what happens beyond induction and the idea of having pathways or routes for social workers to specialise in areas. And in the consultation, as you'll hear shortly, we talk about child protection as the area we're going to focus on first. So just, I'm not going to read all of the stuff on here actually, because I think we're going to come back to it shortly in each individual section. So if we could move on, James, that'd be great. Okay, just a bit on why we're doing all of these things. I think that's a fair question. Some of you might be asking even as we speak in the questions thing. In terms of the post-qualifying standards, as people know, I think they're first launched in November 2015 or thereabouts, so it is a little while. They obviously remain broadly true. The things in the standards are the things social workers grapple with every day. They're at quite a high level, though, we'd argue, and they tend to be sort of what's, not how's. So there's been a feeling for quite a few years that we should go back and in a bit more detail set out the things that we'd like to see and what social workers need to know and be able to do to achieve key outcomes for children and families. We've also, as James mentioned, had the national framework. It's been out for a year or so now with its 4 key outcomes around families staying together wherever possible, greater support for wider family networks to be involved in children's lives, keeping children safe in and outside the home, and also children in care and care leavers having more support. There was a feeling that we really needed to align the new post-qualifying standards to those goals and to the national framework generally. And also they've been changed in the wider landscape in the last 10 years. And, you know, we have Social Work England standards, for example. We need to think about how we complement those. So I think feeling this has been, you know, people on this sort of presentation hopefully agree. There's the feeling that there was a need to look again at the post-qualifying standards and refresh them. We're also, though, interested in the programme that follows, obviously, and as I say, although we're talking in quite hypothetical terms here, there's a feeling that although the assessed and supported year in employment is an important, you know, sort of benchmark, if you like, for people's sort of starting time in their careers, you know, the national consistency isn't really there. There's not an awful lot of support that we provide. It has a quite strong assessment flavour, and local authorities do other things and provide other support for their new social workers. But we're interested in, as James mentioned, with the set of local authorities we've worked with quite intensively over the last year or so, we're kind of interested in like what are the best features of what's currently offered to new social workers, because it does differ, and there are things that some local authorities do that felt like really important things everyone should be doing. And it was interesting that we found a group of authorities who'd already gone for for support continuing into the second year, which is obviously a key feature of what we're going to talk about here and what we're proposing. So there's a feeling that we need to review the standards and update them, and that we need to look again at the support that's offered and to think about what more could be done, essentially. And this is all on the basis, as James said, and I think as Katie said in her introduction, that social work's a really challenging profession, and the start of your career is a time of, it's a steep learning curve, and we want to be helping local authorities help their social workers through that, and other employers. There are high turnover rates. James's slide on the stats there, we are encouraged by the data, but it still remains the fact that quite a lot of social workers leave in the first 3, 4, 5 years of their careers, and that's a shame, and we want to help people not make that choice if it was something that they felt that they just had no choice but to leave. We don't want that to happen. We want to keep people in the workforce, invest in them, see them progress in their careers. So that's very much the pitch of what we're doing with these reforms. Should we move on, James? That's okay. Okay, I'm now going to talk about the post-qualifying standards for a little while in more detail. I appreciate that the consultation only went live at 10 this morning, so I doubt many of you will have a chance to really go through that document in great detail. So I'm going to say a little bit about, what the thinking was behind them, how they're structured and why the structures they are, and what they're for and what they're trying to achieve. So just to refresh for people on this is just a slide showing an example of the format of the current post-qualifying standards, one that have been in place rather since 2015, and just a little sort of on the right side there in the box, just a sort of example of the detail that's there. So that's the first of the standards, and then that's the text that sort of says what's relationships effective direct work might look like. Nothing really objectionable about any of that. It's quite high level though. The whole document is quite short, as people will know, and it's a set of what's really. It's not always hows, and we thought there was more we could do here. Let's move on if that's right, James. Next slide. So this is a slide just showing what's been going on. Some of you might well have been involved in some of these WYSI. I didn't do this slide, by the way, but some of you might well have been involved in some of these processes, which I hope I hope you were. There was a fairly wide group of people and set of bodies that were consulted and work with as part of the process of developing these new post-qualifying standards. And I'm not going to obviously read out everything here on the slide, but we were taking account on just going from sort of left to right here on the diagram, we were taking account of what was already out there, because I'm sure people will have questions, I guess, about sort of, is this like another set of standards, more stuff to deal with? We're mindful that it's a reasonably crowded landscape, and we wanted to try and make sure we were building on what's there. And obviously these post-qualifying standards will replace the current set, so we're not adding to the set of standards. Also, the sort of key theories that we're looking at, if once you get to grips with the new framework and have a look through it, you will see, I'm pretty sure, some of the key theories and some of the key. So it's practice model neutral deliberately, but there are elements there that I think you'll spot of sort of strength based, for example. And we're looking at systems theory, cybernetics, social learning theory, attachment theory. These are the sort of things that the writing group were drawing on when they were devising the new set of standards. Obviously, there's a whole sort of evidence base here that evolves and is improving over time. We commissioned the University of Bedfordshire to do a review of what worked in social work, and that is due out shortly. So that will be out as part of the sort of consultation process, and that was drawn upon by the writing group as they were undertaking the work. And as you will know, there are serious case reviews and national panel reports, a range of things that are out there that are sort of giving us sort of indicators of what's going on in the system and what we could improve, etc. We had quite a lot of people inputting, as saying here, just going along the right-hand side of the diagram here. We ran a Delphi process last year, which people might have been involved with, where we sort of tried to see where people had strong consensus on some of the statements we developed and where there was less consensus and what we could do to work on that and improve it. So as I say, I'm hoping many of you will have seen versions of this framework in the past, because we went quite broadly, but we always wanted to do a full national consultation. So, you know, those processes we went through a year or so ago to sort of refine the framework and seek feedback were only preparatory towards offering something more broadly to the public, if you like, and that's what we've started today. So when you look at the consultation questions, you'll see we ask, you know, most of it is focused on the PQS document, the post-qualifying standards, and is asking sort of what you think about this domain, what you think about this, is the stuff missing, you know, is this the right pitch? And we are absolutely, obviously, wanting your feedback on that, and we will look at it at the end of the consultation and reflect on the changes that might need to be made, or things that need to be added or refined or possibly removed. So that's our pitch. Should we move on, James? How am I doing for time? Not too bad. Okay. So just a slide here, just setting out. So the new PQS in the consultation document have a slightly different format to the current post-qualifying standards. Anti-discriminatory practice, which is not present in the current standards, though it is in other standards and other frameworks in the system, you know, Social Work England's most notably. We felt there was a real need to have something additional, anti-discriminatory practice. The Minister is extremely keen on that too, and you'll see in her foreword to the consultation that she focuses on that. And that's looking in both directions, if you like. It's the families that social workers are working with and how they experience discrimination and racism, and also social workers with protected characteristics themselves, and who appear slightly later in the document in domain 5 on reflection and learning. So I think that's a fairly major addition that I think people welcome, and I'm really enjoying seeing the claps and the thumbs up, which is nice. I hope that continues into the questions shortly. And then the document moves through the sort of cycle, if you like, of social work practice at a very high level. So domain 2, relationships and communication, and it sort of sets out sort of relations with children, with parents, with wider families and other members. It's quite, it breaks down into, you know, which it'd be really interesting to get people's comments on, because it does that quite specifically, because it wants to make sure these different groups of people aren't forgotten. So it isn't just general or lumping it into one. It's sort of saying there are things you need to do with different people, and there's different groups that can help you in your role, etc. And then we move into assessment and planning, and then intervention, and then domains 5 and 6 are sort of looking sort of outwards a little bit more. So, or sorry, 5 is looking inwards, really, I guess, on the social worker's own journey and how they become even more expert practitioners over time, and what they need to do and what they should be doing as with their, you know, their personal development, if you like. And then domain 6 looking into the sort of work of multi-agency teams and the social workers' role with other experts from other professions and areas of you know, the system, as it were, so health, the police, etc., and what the social worker particularly needs to be doing in those circumstances and how important their role is. So hopefully people will see the domain structure is quite logical, and it sort of follows an arc, if you like. I think the anti-discriminatory practice underpins everything, and then we have the core business, if you like, of social work, and then we have some sort of wider issues. So that was the attempt to sort of make something that hung together sort of coherently. And then there's a very colourful diagram in a minute, which we don't have in the consultation because it's probably not accessible, but I'll just flash it up here in this section. But we then talk about outcome statements, and then the document splits out into no's and does statements for each of those outcomes. I'll talk about those in more detail in a second. Should we move on to the next slide, James? I think this illustrates the outcomes. Yeah, so this is the colourful document. We quite like the colours, but I don't think the final version will have them. This was more just our working set of colours. So across the top here, from left to right, you can see the 6 domains I talked about: anti-discriminatory practice, relationships, comms, assessment planning, intervention, reflection learning, leadership management. And then below each of those are a series of what we call outcome statements. There are 26 in total if you count them all up, and you'll see they're roughly 4 or 5 per domain. And these statements are, at a high level, the things that we think new social workers should be demonstrating that they can do. And I use that word really quite deliberately. There was a lot of discussion in the writing group following the work of Miller, and you might be familiar with Miller's pyramid, and the notion that really what we want is that social workers can do these things as part of their practice. So this set of outcome statements here is what we want social workers at the end of 2 years to be able to demonstrate that they can do. And the assessment process that I'll talk about in a minute that we're proposing would be based on social workers showing that they could do these things. And the writing group have I think quite deliberately pitched this to be things that by the end of a second year, appreciate that social workers have different roles in local authority, but they were quite confident. I'd be really interested to get people's views on this in the consultation, but they were confident that this set of things was a reasonable set for all social workers involved in statutory social work to be able to show by the end of 2 years. So that's just important, I think, to just make that point here. Okay, shall we move on? Thank you, James. So here's an example. I showed you an example area of the current post-qualifying standards and how they're structured. It's not massively different, but just to show you the slightly different pitch here of the new post-qualifying standards that we're proposing at the consultation. So we have here this is a sort of snapshot of the start of domain 2 in the document. I think for the consultation, we've to make it accessible again, we've had to lay on top of each other, so you have knows and then does below, so it reads a bit like a big long list, but this is the sort of way we had it in our working version. So you have the domain across the top, so in domain 2, relationships, communication, going back to the chart that I showed you, and then this is the first outcome that you probably couldn't see in the string of boxes below, but this is outcome 2.1, communicates effectively to help build impactful relationships. So that's one of the things that a new social worker will need to show that they can do during the 2 years. And then we then get into a set of knows and does statements, and just really important to sort of say what these are. I think these aren't tick boxes that people will have to do. You don't have to do all of these things. As I know this, I know that. They're guides and they're sort of expansions on what this section is really about. I'm actually really pleased that people are there's lots of emojis going on here, so I think this is chiming with people, which is absolutely fantastic. So here the sort of knows we're saying here on the left hand side of the box, we're saying these are the things social workers should be holding in mind in order to achieve this outcome at 2.1. And then does is the sort of things you might be doing to achieve the outcome. It's not a tick list, you don't have to do all these things, but these are the sort of things that you would be doing naturally as part of your role to achieve this outcome. So it's it's not exhaustive, it's a fairly comprehensive list of things, and the writing group gave it as you can see, there's a lot of text in this document. People's views on that obviously I think will be one of the key things. When you see the whole thing, it's a lot lengthier than the current post-qualifying standards, there's no doubt, but I'm hoping, and I think the writing group will hope, that you will find this extra detail really helpful, because it really does sort of go into that what does this look like, what is the standard, how are people going to be doing these things, what scenarios might these things be happening in, and I'm hoping that people will, there might be a balance to be struck on length, but I'm hoping the extra detail people will see as helpful. And there was a real, this isn't my work at all, it's the work of the writing group led by Laura, but we had a lot of meetings, spent a lot of time looking at this. This wasn't knocked off in a few hours. There's been real thought into the text here, and you'll see when you look at it yourselves that each of the statements really is sort of woven through with the sort of knowledge and skills that you might need, the background knowledge about harm types or child development, the theories that we mentioned at the start here, so attachment theory, intrinsic motivation, and some of the tools that are in common use. So hopefully it looks like it is chiming accordingly. I'm not obviously going to go through every single section because that would take a while. I was just showing you this, an example of the sort of pitch that the document has, and I'm pleased to see I think people are generally liking it by the look of it. Let's move on. Yeah, James has moved me on. Okay, let's move on to the next. Okay, so I'm going to talk a bit, I'm moving away from the standards themselves. I'm talking more about the sort of program that might follow from it, although, as I say, heavily caveated that this entirely depends on the forthcoming spend review, but we obviously have spend review bids prepared, and we're in the mix, and we're hoping to be successful in securing the funding for this program. I mean, obviously it's a 2-year program, as you know, as I said at the start. So at the very least, there's a need for it to be funded for 2 years, because you know, as you will know, the current assessed and supported year employment is only 1 year, so moving to 2. But this is just a little compare and contrast, really. So on the left of this diagram, we have sort of ASYE. It's 1 year. It's based on the current post-qualifying standards. There's protected caseload. Local authorities provide the support, and we have relatively little input into that and don't specify anything particularly. There's an assessment process which you know, I think we have heard, and Skills for Care, who would administer this end of the process for us, know as well. There are issues that people have raised about the amount of work that goes on in the assessment process, the amount of writing involved, and so we have been thinking about that. I'll talk a little bit more about that in a minute. And then just on the right hand side, the orange future box, we're moving to a 2-year program. It's the new post-qualifying standards. It's going to be called the social work induction program, or similar. We have heard already, actually, people don't really like induction, because I think people think of induction as something happens in the first few weeks. So maybe there's another word, development or something might be better. Because people are in full employment, they are qualified, and what we're doing is helping them through these 2 years. So we're, you know, I think we're up for changes of name if people want to suggest one. Protected caseload is still very much in our thoughts, obviously, and that's both. I mean, I think there's 2 aspects of that people talk to us about a lot, which is both the time away from the caseload, but also the caseload itself and what that looks like. Because the time is one thing, but obviously you can't always completely determine how your cases will unfold, but there has to be some notion of sort of trying to protect the sort of cases as well. So that's something we're absolutely looking at. It's still local authority based support that we're proposing in the consultation. So this is a local authority led program. It's not a top down DFE program that we're proposing, but as you'll see in the slides that follow, we are thinking about what more we could offer with our central purchasing power and ability to, you know, produce more materials, guidance and support in the process, which is the bold bit there. Sorry, CPD training, guidance, materials, and we say assessment activities there, but I'll talk about that a bit more on the next slide. But broadly, what we're saying is that the assessment is still local authority led at heart. You know, it will be based on the outcomes that I mentioned, the 26 outcome statements, with social workers providing evidence that they could do the things, you know, in that framework. Thanks, James. Let's move on. I'm aware, sorry, I don't cut all the time for questions, so I do need to hurry up a little bit, don't I, really? So, okay, so I'm talking here about the social work induction program again. So this is what we're pitching in the consultation document, again, subject to spend review. So I think just on support and resources, just flicking over the aims. I'll talk about the aims for a second. I think this is quite important. I think we say in the consultation document that we are looking for national consistency, but we recognise completely that can't be at the expense of local flexibility. We're trying to hold both in mind as we move forward with this work, and it's work-based learning. You know, people are not out at college, they're not doing a degree anymore. We've been through that. What this is on-the-job learning, and it's locally based in the local authority. The same sorts of people as now, the practice supervisor, the assessor roles are ones we envisage being needed in the future. That one-to-one between the supervisor and the new social worker, I think, will be the heart of what goes on. But we're also interested in what else we could do to support that without making it unmanageable and having so much going on that local authorities, you know, it's distracting from the day job, which is obviously what this is all about. So we are thinking about high quality training materials, so a little bit more support than is currently provided by the department. That, you know, that might, James mentioned the digital program we have, so we might be looking to host materials on a platform that people can access that could be about key knowledge areas, like harm types, you know, domestic violence, with the violence against women and girls strategy, obviously at the forefront of people's minds, and the child sexual abuse. And there is a thought that there could be more done there to sort of make sure everyone has the absolute up-to-date knowledge about those things. So might that be areas that we focus on? For example, could we produce more just to help the sort of system? You know, could we do more for practice supervisors and provide some support for those? We posit that in the consultation, as well as the things you'd expect, the sort of guidance documents and the broad materials. And that goes for assessments as well, where we're working what the assessment process will look like, but our plan is it's based on the 26 outcomes subject to the consultation. It's social workers providing evidence, but we want to make that slicker than it is at the moment. There is a lot of writing. We see that in SWA and other people looking at the writing, and there's a little industry, I think, around some of that. And I think we want to see if we can, while still having something valid and reliable, have it slightly lighter touch and more people being able to show the things they're doing in their job rather than retrospectively, perhaps sometimes sort of writing about it. And the consultation talks about who's eligible as well, and there are some proposals there. And I think all I would say on that is that these standards are quite, that the writing group are clear they're achievable, but they're challenging. They are based on the demands of statutory social work. They have quite a strong safeguarding flavour. And so I think people are going to have to look at them who are not, doing, they might be doing aspects of statutory social work, but I think there's a need for people to look at them and see how they could meet them, and we're up for discussions about that. I'm thinking mainly about sort of the social workers who are not in local authority employment, I think. So we're not saying they're not eligible, absolutely not, but we're saying that there is a need for a discussion about how that is going to look. Okay, right, James, sorry, I will. One more minute because I can see we're so just just talking really briefly here about we mentioned, not in passing, but the consultation is about the post-qualifying standards and the programme that flows from it, but we also make reference to the pathways that might exist beyond a social worker's induction, and we do talk about the idea of a child protection pathway, which has long been something that people have been thinking about and talking about, and we're proposing that we make a start with that, and we ask some questions in the consultation. I think something just to make clear on that. I mean, there's not a great deal more to say at this stage because we're working on this now, and it's quite a new area for us. But we don't see it. I think there was talk in the past about a continuous 5-year induction, for example. We're not saying that. We're saying it's a 2-year induction, and then that there will be routes open to people, and not necessarily just people in years 3, 4, and 5. You could be at points beyond those years and still access these pathways. So that's our sort of policy position, and then we're going to be building out from that and listening to people's views in the consultation. And I think, James, that is the end of our section. I think we're thank you and questions. So got 10 minutes left, and I think our colleagues, we have been collating some questions, and we're going to take a group of them now. But obviously we can look at all of the questions and have a think about them and have a think in the context of the consultation. So thanks everyone, thanks for listening, and thanks for your clapping hands and things.
Wonderful. Thanks, James. Thanks, Jim. Wonderful. Yes, as you said, the questions have been rolling in. So we'll just take this kind of last 10 minutes to bring those few to the discussion. So there were a few around whether it was possible to, or whether it would be possible to share the slides from today's session. As I said earlier, we've recorded this session. It'll go up on YouTube soon after Social Work Week, so you'll be able to view the slides there. Another question that popped up a few times was around the projected timescales. So wondering timescales not just for the consultation, but beyond when you think you might be able to publish the outcome of the consultation, etc.
Yeah, sure. So we're looking to have, well, I mean, there's a civil service phrase here. There's a civil service summer, which is when we like to get the consultation out, which might be a tiny bit later than other people's summers, and that would partly depend on when we can get it to ministers, because there'll be recess and things. But essentially the plan is, as I mentioned earlier, the consultation closed the 20th of May. We'll be doing some analysis as we go along. We'll be producing a report. We'll be sending that to minister, and then we'll be publishing it. And also in parallel, we'll be meeting with the writing group to look at the suggestions around the post-qualifying standards. So I don't want to commit to literally a date, but we generally, I think, are required to try and get the consultation out in about 12 weeks, the response out in about 12 weeks of the consultation. So we're sort of late summer, early autumn, essentially, is our plan as soon as we can do it.
We also had some questions.
Sorry, Katie. Was part of that question as well about, and in the longer term,
wider
what are the sort of timescales?
Okay, fine.
So, I mean, the short answer is subject to spending review, but the longer version of that is we're looking at, for the social work induction programme, introducing that from September 2027. But the exact implementation timescales do need to be worked out.
Thanks, both. Another question then for you. Obviously, this framework is aimed at newly qualified social workers, supporting them as they transition into practice. But a few people have asked if there's any plan longer term to expand this beyond newly qualified to help with standardisation of experienced and advanced social workers.
So we talked a little bit about the kind of ongoing CPD and the advanced practice in there, and we think there is merit in thinking about what advanced practice in particular areas looks like, and that is probably something that builds on this set of standards. As Jim said, we're sort of just starting that work at the moment, but there probably is something to come on that. I mean, in terms of kind of, you know, ever expanding plethora of standards and frameworks, I think we need to be slightly careful. There's already quite a lot out there. We think there is a need for this thing, and there probably is a need for some other things, particularly where we're talking about things like child protection, for example, but need to kind of think through what's the purpose of it. So this is a really clear purpose, which is to set out, you know, the expectations, and the way it's constructed really helps to define curriculum and training materials and assessment materials as well. So there's a sort of really clear purpose to it. I think that would be the starting point for future activity as well.
Okay. Thank you, Rob. Sorry, Jim, did you want to
No, I was just waiting for your next question. Sorry, no, I'm perfectly happy with James.
Wonderful. Moving on then. So at the beginning of your presentation, you talked a bit about you know, the census and some of the ongoing workforce issues, but how they're hopefully moving in the right direction. So on recruitment and retention being an ongoing challenge, how can social work education providers, practice educators and others best support this work?
So that's a really good question, and I wonder whether, you probably don't know, Katie, but whether this work means the new PQS and social work induction, or the work more generally on recruitment and retention. I suspect it's the latter. So, I mean, social work education has a huge role to play. You know, the thing Jim was saying about people leaving early in their career, I think is driven by, you know, in part, you know, things like working conditions, you know, culture, etc. And there's a huge role for leadership there, but in part as well because social work's really challenging, and so being as best prepared as possible and then having a sort of smooth landing where you are supported, we think, you know, will help to encourage people to stay in the profession. I think many social workers who leave do so with a heavy heart, because it is a sort of calling for people who really want to make a difference. And so really high quality initial education can only help with that sort of retention piece as well. So, and then sort of more specifically in terms of the PQS and social work induction. So, you know, a social work qualification is, you know, generic across child and adults, but, you know, my hope would be that initial education does sort of pay heed to what comes next, what could potentially come next if people choose to go into child and family social work. But yeah, that's a really important area as well.
Thank you. And perhaps slightly linked to that, or following on from that, you've spoken about wanting to invest in social workers and concerns over practitioners leaving the profession early. Do you have anything that you would like to say to anyone in the session listening today that may find themselves in this position?
Of thinking to leave the profession. I mean, that's difficult because, you know, you don't know one's personal circumstances, etc. I think overall, what I would say is, and I hope it's not, well, he would say that, wouldn't he, because he's from the Department for Education, but the overall reform agenda for children's social care, I think, is really exciting. I think there's been more announcements today about Families First activity, the additional funding that's going in, the real sort of palpable sense of positivity around that shift away from the acute end of the system to prevention, which I think all social workers, everyone I speak to, sort of wants to see. There's debates, there's discussions about, particular policies and projects, and is that exactly the right thing that's going to achieve it? But the overall ambition, I don't think I've spoken to anyone who disagrees. And so my hope would be that over the coming years, we really start to see that flowing through, and it becomes even more rewarding profession, and that on our workforce reforms we do start to keep seeing those numbers going in the right direction, more people coming in, potentially people coming back to social work, providing that extra capacity, really high quality leadership, creating the culture and the right systems to work in, so that is, as I say, as rewarding as possible. So that may feel a bit like a bit of jam tomorrow promises, but do engage with our consultation, with the other activity coming out of the department, because I think it's a really exciting time to be part of the sector.
Thanks, James.
And we have a minister, just to say, in Janet Davey, who's absolutely committed to the social work workforce, and as most people know on the call, was a social worker herself for quite a few years, and is absolutely wanting to make a difference here, which is great for us.
Thanks, Bo. I think one last quick question then. In terms of the family approach to reform, what support do you think is needed within adult social care to support this work?
Really good question. I don't know it's that quick. So, I mean, obviously, we have a sort of, in a way, a sort of artificial divide, don't we, between children and adults. Children become adults. Many of the children who have experienced the care system or had the support of a social worker may go on to have continuing challenges that they need support with, and that kind of handover period, particularly 16 to 19 up to 25, etc., I think is really important. And of course, in families there are adults, and many of those adults have things they're struggling with as well. And so I don't think there's any sense that we are particularly focused on child and family social workers, but I don't think there's any sense that that detracts from the overall profession of social work and the need to kind of continue to work together. And I think with the sort of multi-agency approaches that are being taken forward, I think that should include, of course, adult social work as well. So yeah, that's a short answer to quite a big question.
I think James has said it as well, but obviously the new post-qualifying standards are the child is the focus, obviously, but it's all about the change that can be made, and the adults are the people making the change, which maybe not quite the same as adult social workers there, but in terms of the focus, they're the people the framework's about, essentially, because it's about what they need to do for their children to have a better future, essentially.
Thanks, both. We are actually slightly over time, so I'll have to leave it there, unfortunately. But thank you to both of you for a really interesting session. As I said in the opening, you're happy for us to make the recording available on
Yep.
YouTube, so that'll be coming along soon. We hope that you've all enjoyed today's session. Thanks, everybody.
Thanks for having us.
Thank you.
Thanks, Katie. Thanks, everyone. See you soon.